Hi, Mr. Dean. My name is Andrew, and I'll be your nurse today. Before we get started, I'm going to close the door and make us some privacy for us and wash my hands. I'm going to do my assessment and ask you a few questions. Can you first tell me your name and date of birth? Matt Dean, August 25th, 1986. Can you tell me where you are? St. Joseph South. Can you tell me what month and year it is and who the president is? March 2021 and Joe Biden. Are you having any chest pain or any difficulty breathing? No, just a pain in my abdomen where they made an incision for my procedure yesterday. I am having some difficulty breathing. What would you say your pain is on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever experienced? 4. How would you describe the pain? Sharp. Is anything worsening the pain? It's important to know if you're experiencing any worsening pain or chest pain following the insertion. No, it feels the same. I noticed you had an incentive spirometer on your table. Is it okay I teach you how to use it? Sometimes after surgery, our lungs may need to be re-expanded, and so I'll walk you through using it. First, you'd want to place the incentive spirometer on your mouth. Take a deep breath into it. Try using it throughout the day, about 10 times per hour. Uh, you can do that during commercial breaks. Thank you. I'll be sure to use my incentive spirometer 10 times per hour. I'm going to take a listen to your heart and lungs, and then I'm going to move down to your abdomen. So just for you, I'm going to make sure that you're breathing normal, and when I take a listen to your abdominal area, I'm going to listen for about 5 minutes. And that's just because sometimes with the medications, uh, it slows down your digestive system. So I just need to make sure that the bowel movements and sounds have returned. Have you experienced any nausea or vomiting this morning? No, just dull pain. When was your last bowel movement and was it normal for you? Yesterday morning and it was normal. How about when you last urinated and did it feel the same as it did before surgery? And are you experiencing any pain or burning sensations? This morning. And I didn't feel any pain. It felt the same as it did before the surgery. So I know you're having lower abdominal pain right now. If it starts to climb upward, or if you start feeling any radiation up towards your arm or back, or it just doesn't feel right, please don't hesitate to use your call light button. We're also going to keep track of how much fluids you're drinking and how much you're urinating. So I'm going to leave a urinal in your bathroom and also one nearby at your bedside. I ask that you use this to keep track of how many fluids you're taking in and out. Um, it's just a precaution for anybody that's post-surgery, and we just want to make sure that your kidneys are functioning correctly. Okay, that works for me. Okay, I'm going to show you some little exercises that we can do in bed. First, I'm going to have you squeeze my hands. Okay, and now I'm going to have you push down uh, on me with your legs. Uh, try to keep them from lifting up. Try to keep me from lifting you up. All right, that's great. And are you experiencing any numbness or swelling? Anything that doesn't seem right with your hands or feet? Keep doing these kinds of exercises. It's going to help improve blood flow and keep your extremities strong. No, I don't feel any numbness or swelling. Okay, I'm going to check your IV sites and I'm going to flush them. Are you experiencing any pain or weird sensations in your IV site? Any swelling or redness? No. Great. If at any point your IV starts burning or you feel any swelling, please don't hesitate to use your call light because we want to make sure that the medication that we're delivering is working and going through it. How's your home life and social life? Do you have any hobbies? How often are you exercising? I'm happily married with 2 kids. Um, on the weekends, we spend time with family and our neighbors. I get a chance to play tennis, and I teach my kids how to play. I typically run 2 to 3 times a week, and I weightlift also. It's great to hear. Well, I'm all done with my assessment. Do you have any questions for me? I'm good.